Fox 56 News Chief Medical Contributor Dr. Ryan Stanton is back, and we love it. The NFL playoffs kick off tomorrow, and unfortunately, injuries happen.
One of the most common is knee ligament damage, but what exactly goes on with the anatomy when that happens? The doc is here to tell us.
Yeah, absolutely. And it is playoff weekend for the NFL. 2 games right here on Fox this weekend, Saturday 4:30, Sunday 4:30. And we're talking about the knee. And what is exactly the knee in terms of the ligaments? So a tendon comes off of a muscle and goes to a bone. A ligament goes from bone to bone. With the knee, we have 4 ligaments: the ACL, the PCL, the MCL, the LCL. Just based on where they are, the front, the back, the inside, and the outside. They're designed to actually keep the femur on top of the tibia. So when we're running, we're athletic, it keeps it in place. Now with athletes, this is very important. On a daily basis, we could do without one, but with athletes, it's very important to keep that femur on top of the knee and allow them to function to do the pivots that you see in football, racquetball, and tennis. It is one of the most common associated injuries, and based on the impact in these types of injuries, especially with football, that's how we can determine what type of injury that we are going to see. So the basic anatomy here that you see with the MCL, MCL lateral, and the anterior and the posterior are there to stabilize and keep that knee in place. So what we're going to talk about when we come into the next hour is what happens with athletes getting an injury and what happens when you get an injury and how we're going to take care of it. So as you see here on the screen is a lateral view as well. It's a lot easier in this one to see the anterior being the one in front, and the posterior, which are the most common and significant injuries we see as well. And I heard that, Kristen, you had one as well?
Yes, I was in high school and I was playing volleyball and I tore my ACL. I have a giant scar and everything.
So you got the repair?
Yes, I did have the repair.
Yeah, it is one that tends to happen. And actually, Paul, this was a topic you wanted us to talk about. This is a recovery that tends to last several months, especially if you want a good recovery. And if you're young and you have this, make sure you get that recovery right. You don't want to have that issue with your knee pain the rest of your life.
And you said next hour we're going to delve a little bit more into what you do once this happens, how to treat it.
And based on whether you're an athlete or you're just trying to get around town and the type of tear you see.
Okay.
Lots of information, lots to look forward to. Yeah, you're right. Stay with us.
Stay with us.
How's your knee?
More of us coming back.
Stay tuned.